Hi all, welcome back to the Clinical Shots. Today I came up with a very interesting topic, that is subacromial pain syndrome, or which used to be referred as subacromial impingement earlier. So firstly, let's look at this condition according to the term that it used to be referred before, that is subacromial impingement. So if you find this really interesting, let's quickly dive into the video. So if you can just take a closer look at the shoulder joint, you can find the subacromial space below the acromion and above the glenoid. So this is a space where few key structures gets compressed and causes the pain and leading to the condition called subacromial impingement. As I've mentioned a second ago, what are the key structures that often gets compressed here very commonly? They are the subacromial bursa and the supraspinatus tendon. So the surgeons often perform the decompression surgery by releasing that coracoacromial ligament by believing that this would open up the space and reduces the compression. They does this arthroscopically. So and also they tend to remove the portion of the subacromial bursa sometimes in order to reduce that decompression. And also in some cases they might remodel or reshape the portion of acromion and release that impingement. So now the real problem was, even after performing these surgeries, the patients often started experiencing the same amount of pain at the shoulder joint. So the results and the outcomes after the surgeries was not good as expected. The patient started experiencing the same pain as they had before. And then this led to some major researches and trials and came up with conclusions that there are very little differences in the patient's outcomes, whether the surgery is performed by releasing few structures to reduce the compression or whether the surgery is performed without any changes in the subacromial space at all. And also this led to a whole discussion of these surgeries are not actually reducing the compression caused by the impingement. Perhaps impingement isn't the reason behind the patient's pain at the shoulder. So this led to us stop using the term impingement. And the subacromial decompression surgeries are offered very less by the surgeons to the patients with shoulder pain associated with subacromial bursa all over the world. So in case they offer, the patients are told that they may not get rid of their symptoms totally following their surgery. So this not only brought the change in the way that we look and treat this condition in interventions of shoulder pain associated with subacromial bursa, but also the way that we explain this to our patients has been completely changed. Previously, the patients used to get stuck in the thoughts that there are some structures that are squished at their shoulder. It is very complex to explain to them as well in a simple term. And now they are getting a lot more reassured about the situation, and they don't have to essentially go to the surgical intervention in case if they get this. And nowadays we are calling this term as rotator cuff related shoulder pain or subacromial pain, and emphasizing that strengthening that rotator cuff or treating that tendinopathy will ease their symptoms or also treat their condition. Hope this video has given you some things to think about the subacromial impingement. I hope you find it really informative and insightful. In my upcoming video, I'll also be sharing few objective tests that we often consider doing it on the patients when they come with shoulder pain. And it is very essential to understand before we do it on the patients to create a realistic treatment plan that is very effective for them and to be patient-centric when we are working under the clinical settings. So that's all for today, and bye for now.